Hey guys, this is Manu Kalia, physical therapist and Ayurveda herbalist. So I'm going to show you guys some simple exercises, but also some very effective exercises for knee-related problems, especially patellofemoral problems that you can do, especially when you're not tolerating weight-bearing activities. So running, squatting, single leg balance exercises, which are putting a lot of load through that knee. A lot of compression and irritation of that patellofemoral joint. So you still want to maintain the strength of the quad muscles and all the other muscles. So in that case, a good way to approach this is to do non-weight bearing exercises first. And we're going to start with first the simplest one in order to get your quadricep muscles working again. Okay. So now remember, and I mentioned this in some of my previous videos, the patellofemoral joint it's your kneecap, and it sits on the groove that's created by your thigh bone, which is your femur. So here's the kneecap, top of the kneecap, bottom of the kneecap. Here's your patellar tendon, and the irritation and pain often going to be around in this region. Could be in the patellar tendon, could be radiating to either side, and sometimes even in the back. Okay. So the first exercise, just to get the quads moving and working again, is you can use a towel or something else. But just to show you, illustrate the point, I have my hand here as a towel. Go ahead and push down. So this is called a quadriceps. She's just pushing straight down, and she's activating the quadricep muscles. Okay, and go ahead and push down. And you can just do some isometric stuff just to create contraction, create a pumping effect, get fluids out of the region if there's some swelling, and just to get these guys working again. Now you have to keep in mind though, often or at times you'll find that the patellofemoral joint, the kneecap, is also very stiff, or the local structures are so irritated when you do. Go ahead and push down. If she really straightens out that knee, it almost causes a compression of that kneecap. Okay? So that kind of irritates that structure more. So sometimes people don't like fully overly extending that knee. That full extension hurts at the base of the kneecap or along the borders of the kneecap. Okay? So obviously you can limit the amount of extension you're doing or how far you push down just to get the quads working again. Okay, and I decided we're not going to pick exercises where the standard sitting down and knee extensions or any of those things, because often when you're doing resisted knee extension movements, remember that kneecap glides up and down, and if things are already irritated, sometimes that gliding back and forth irritates a lot of these structures. So we're going to work on straight planes. We keep this the way it is, and we're going to work at strengthening the quadriceps, okay, as well as other muscle groups. So the progression will be, so first part as we did was quadriceps, go ahead, push down, and she holds it there, isometric stuff. Progression is, I want her to start, once she gets better at that and there's less pain, is to do some straight leg raises or lifts. So tighten up the quads, good. So first you kick them in, and now she's going to lift the foot towards you up to that point. So now quad is on, even the hip flexors are working a bit. And so it's a little bit higher level now than the simple quadricep movement, okay? Now let's make it a little bit more interesting and also involve some of the other muscle groups, all right? So let's bring it back down. And you can do repetitions, okay? Good form to the point of, we're going for endurance, fatigue, okay? But that might vary from person to person and how the joint tolerates it. That's the other thing. If it gets irritated, doesn't tolerate it, you need to back off, okay? Now, to make it more challenging, I'm going to have her push down, opposite leg, pushes straight down. So now she engages her hamstrings, even her glutes. Okay, so pushing down, bracing the pelvis also. Tighten up the quads again, push straight down. Yeah, the quads are tight. And I'm going to have her do a partial sit-up or a curl to get the core working. So come up. So now she's engaged this. She's got the hands working, the glutes are working on the opposite side. And now we're going to kick in the quads and then bring the leg up. So she can hang out there and she can do work right in that plane. The advantage is when she kicks in her abdominals and her glutes and hamstrings and all these guys on the opposite side too, one, she takes a lot of the pressure off her low back with this exercise. The second thing is, of course, she kicks in many muscle groups. So you don't have to do tons of exercises. It's just improving the, or making it more challenging for various muscle groups, okay? Incorporating a lot of different groups together with it, okay? So do it again, please. So kick it in, and now she can work at holding that position. So these guys are on, and she might fatigue there, so she might want to work at moving through here, and if she fatigues, obviously she comes back down, and then bring it back down. Okay? All right. Now, if you want to make it even more challenging, so the next phase of this would be she's going to kick in these guys again. I'm going to have her actually bridge up. So she's going to lift up a little bit, and she's going to kick this up too. So now she could do is she's kicking in, really kicking those hamstrings or the glutes, and she's also kicking her quads in, and she's working. Now the key is she has to be stable and strong enough through here and the glutes to maintain the alignment of the pelvis. Okay? Now she's really firing a lot of these muscle groups through here, and core stability. Much more challenging exercise, okay? So if you put a stick here and the stick tilts to one side or the other, you know the pelvis is not holding its position and it's collapsing. But then you're not ready for the exercise. Alright? Good. Come back down. Very good. So I hope that gives you an idea, at least one set of exercises. And there are lots of exercises that we can do for this condition. But for those of you guys that are runners, and I've gotten a lot of questions from you guys about with patellofemoral problems or runner's knee, and other knee problems also, what to do when you're having this problem and if you can't tolerate some of the standard exercises or a lot of the weight-bearing stuff, okay? So I always look at it as a comprehensive approach. You have to address what's happening below, above the joint. You got to treat the whole system, okay? Not just working in the quads. You got to hit all these different groups to really get a good solution to the problem, okay? So those of you guys having patellofemoral problems, this can be a good exercise, and also other knee problems too. If you have any questions, leave a comment, and if you want me to shoot a video about a specific subject, any problem you're having, leave a comment, and we'll look into shooting something for you guys. And subscribe to the channel, and shoot me an email if you have a question. Thanks.